I hope that this presentation will be informative to you all, and we'll go ahead and get started with section GG. So as with all of our presentations, we have these acronyms at the beginning. They're also in your packet, so you do have them available for you to look at and peruse. So the objectives for this presentation, by the end of this presentation, I hope that you'll be able to demonstrate an understanding of the standardized items in section GG, Functional Abilities and Goals, describe the intent, coding instructions, and definitions for the section GG items, and then we're going to do a number of coding scenarios, practice coding scenarios, so hopefully by the end you guys will be able to apply coding instructions to accurately code these, and also with the case study. So we will be using Slido a lot, so if you haven't yet had the opportunity to log in and participate with your Slido, I encourage you to do so now. Okay, so section GG across post-acute care settings. In 2014, the Impact Act was passed to create more alignment across post-acute care settings, and that's inpatient rehab facilities, skilled nursing facilities, long-term care hospitals, and home health agencies. The intent of section GG specifically related to IRFs is patients in IRFs have self-care and mobility limitations and are at risk for further functional decline and complications due to their limited mobility. So we'll start off with the overview of section GG items. There's really 4 items that we focus on with section GG. GG 0100, which is prior functioning with everyday activities, which is assessed on admission. GG 0110, prior device use, which is also assessed on admission. And these 2 items tend to help clinicians really determine how they would like to set up goals and their care plans. So GG 0130, self-care, and GG 0170, mobility, are assessed at both admission and discharge. So we'll start off with GG 0100, prior functioning with everyday activities. The item rationale is, of course, to establish knowledge of the patient's functioning prior to the current illness, exacerbation, or injury. And, of course, the hope is that it would inform treatment goals for this patient. It's completed only at admission, and we'll go through the coding specifically in just a couple of slides, but they are a little different than what you would code for section GG items, so just be mindful of that when coding them. The first item in this prior functioning is GG 0100A, self-care. And this is where clinicians would code the patient's need for assistance with bathing, dressing, using the toilet, or eating prior to the current illness, exacerbation, or injury. Next, we have GG 0100B, which is indoor mobility or ambulation. And here, clinicians code the patient's need for assistance with walking from room to room, with or without a device, such as a cane, crutch, or walker, again, prior to the current illness, exacerbation, or injury. Next is GG 0100 stairs, and here clinicians code the patient's need for assistance with internal or external stairs, with or without a device, such as a cane, crutch, or walker, and again, it's prior to the current illness, exacerbation, or injury. And finally, we have GG 0100D, functional cognition. And this is where clinicians code the patient's need for assistance with planning regular tasks such as shopping or remembering to take their medication, again, prior to the current illness, exacerbation, or injury. So the steps for assessment is interviewing the patient or the family. We'll see with the example in just a couple of minutes that interviewing the patient obviously is very helpful, but also you get useful information from their family members too. So don't discount that, of course. And then reviewing the patient's medical records for details describing the patient's prior functioning with everyday activities also provides a lot of valuable information. So the coding instructions, as I mentioned, this is different from the 6-point scale with other section GG items. The first option is to code 3 as independent, and you would use this code if the patient completed the activities by himself or herself, with or without an assistive device, with no assistance from a helper. Code 2 indicates the patient needed some help, and this can be partial assistance from another person to complete the activities. Code 1 indicates dependent. So if the helper completed the activities for the patient or the assistance of 2 or more helpers was required for the patient to complete the activities, you would code 1 dependent. Code 8 is unknown. So if the patient's usual ability prior to the current illness, exacerbation, or injury, you can't get it from talking to the patient, you can't get it from talking to their family members, you can't get it from the medical records, then you would code 8 unknown. And code 9, not applicable. So if the activity was not applicable to the patient prior to the current illness, exacerbation, or injury. So an example of this is if a patient wasn't doing something before admission, you would code 9, not applicable. Okay, and as I mentioned, if no information is available about the patient's abilities after attempts to interview them or their family members and reviewing the patient's medical record, you'd code 8, unknown. Next, we have GG0110, prior device use. So the item rationale for this is that if a patient's routine use of device and aids immediately prior to the current illness, exacerbation, or injury, again, would inform treatment goals. This is also completed only at admission. This is what it looks like on the IRF-PAI. And you would check the steps for assessment, of course, are interviewing the family members or the patient, of course, and reviewing the patient's medical records, describing their use of prior devices and aids. You would check all that apply. That's the coding instructions for GG0110. Your choices are manual wheelchair, motorized wheelchair and/or scooter, mechanical lift, walker, and orthotics or prosthetics. And you do have an option to check Z, none of the above, if the patient did not use any of the listed devices immediately prior to the current illness, exacerbation, or injury. So GG0110C, a mechanical lift, is any device a patient or caregiver requires for lifting or supporting the patient's body weight. And examples include, but this is not an all-inclusive list, are stair lift, Hoyer lift, and a bathtub lift. GG0110D includes all walker types, and examples, again, include but are not limited to pickup walkers, hemi-walkers, rolling walkers, platform walkers, four-wheel walkers, rollator walkers, knee walkers, or walkers for mobilizing while seated in walker. Okay, so we're going to watch a video now, and in this video you'll have an option to witness a clinician talking to a patient and their family member. This video takes place in an ADL suite, so that's why it looks more like a home environment in an IRF, and we'll talk about it after it's over.
Let's watch a scenario of an assessing clinician collecting information from multiple sources to code GG0110 prior device use.
I noticed you have a few different devices here, Mr. Smith. Which of these were you using to help you walk just before you went to the hospital?
I wasn't using anything. I was walking on my own.
How's it going? Can I help answer anything?
I was just asking your husband which of these devices he used to help him walk before going to the hospital.
Oh, he was using that cane over there to help him get around.
Oh, yeah, I guess I was using that.
Okay, good. It also says here in your hospital discharge paperwork that you're using a walker before you were admitted. Is that right?
Yeah, I guess I used that when I went outside.
Okay. And I see a wheelchair over there. Were you also using that?
No, that's mine. I was using it when I had chemotherapy last year.
Okay, thank you for clarifying. And were you using anything else like a shoe insert or a chairlift in another room, anything like that?
No, that's all, just what I told you.
Let's examine what you just watched. The clinician interviewed Mr. Smith and his wife using observations of the environment to ask probing questions. The clinician also referred to Mr. Smith's acute care medical record and confirmed the information with Mr. Smith and his wife. In this scenario, the clinician used multiple sources of information to determine that Mr. Smith was using a walker and a cane prior to his recent hospitalization. Prior use of a cane is not captured in GG0110, so only option D, walker, should be checked. This video provided you with an overview of how to use information from multiple sources to accurately code GG0110 prior device use. Collecting information from multiple sources ensures accuracy in coding. In this scenario, if the clinician did not use multiple sources, he may not have received enough information to make an accurate assessment of Mr. Smith's prior device use. We hope you found this scenario helpful. For more information on coding Section GG, refer to your setting-specific guidance manual on the CMS website.
Okay, so we're going to have an opportunity for slide. I know you guys just got the answer, just to make sure you guys are awake. How would you code GG0110 prior device use? Would you A, check A, manual wheelchair, B, check D, walker, C, check both A, manual wheelchair and D, walker, or D, check Z, none of the above? I see there's overwhelming responses for B. Let's go ahead and take a look at the correct answer. And it is B, check D, walker. The rationale behind that, of course, is the clinician used multiple sources of information to determine that Mr. Smith was using a walker and a cane prior to his recent hospitalization. Prior use of a cane is not captured in GG0110, so only option D, walker, should be checked. Collecting information, again, ensures accuracy in coding, and if in this scenario, if the clinician didn't talk to Mrs. Smith or read the medical record, he probably wouldn't have gotten the information to make an accurate assessment of Mr. Smith's prior device. Okay, so now we're going to get into GG130 and GG0170. So starting off with GG0130, it identifies the patient's ability to perform the listed self-care and activity. GG0170 identifies the patient's ability to perform the listed mobility activities and discharge goals. The steps for assessment: qualified licensed clinicians assess the patient's performance based on direct observation and then reports from the patient, it says resident here too, but also clinicians, care staff, and or family. Patients should be allowed to perform the activities as independently as possible as long as they are safe. If helper assistance is required because of a patient's prior performance being unsafe or of poor quality, clinicians should score according to the type and amount of assistance provided. Activities, again, can be completed with or without assistive devices, and use of assistive devices to complete activities should not affect coding of the activity. Again, we refer to facility, federal, and state policies and procedures to determine which IRF staff members may complete an assessment. Patient assessments are to be done in compliance with facility, federal, and state requirements. So these items are assessed within a 3-day assessment period. The admission assessment period is the day of admission and the following 2 days ending at 11:59 p.m. on day 3. So if a patient was admitted on a Monday, their admission assessment period would end at 11:59 on Wednesday. Discharge assessment period, again, is the day of discharge and the 2 calendar days prior to the day of discharge. So if they discharged on a Wednesday, you would use the 2 calendar days, so Tuesday and Monday prior to the discharge for the discharge assessment period. Usual status, so the patient's functional status should be based on a clinical assessment of the patient's performance that occurs soon after the patient's admission. The admission function scores are to reflect the patient's admission baseline status prior to any benefit from therapeutic interventions. And one thing we do ask clinicians to consider is sort of the circumstances that are surrounding the patient. So if it's a new environment for them or they haven't slept much, consider that when you're coding usual status as well. With discharge, we code the patient's discharge functional status based on a clinical assessment that occurs close to the time of discharge. Patient's functional status, as I just mentioned, can be impacted by the environment or situations encountered at the facility. Observing the patient's interactions with others in different locations and circumstances is important to get an overall understanding of the patient's functional status. If their status varies, record their usual ability to perform each activity. And so I know this can sometimes cause some consternation, but we say do not record the best performance or the worst performance, instead record the patient's usual performance. So the 6-point scale, so this is what we use for GG0130 and GG0170 for coding. Code 06 indicates independent, and this could be again with or without a device. Code 05 is setup or cleanup assistance. Code 04, supervision or touching assistance. Code 03 is partial or moderate assistance. Code 02 being substantial or maximal assistance, and Code 01 being dependent. So if the activity was not attempted, clinicians should use indicate the reason the activity was not attempted using one of the 4 activity not attempted codes. And these are 07, so if the patient refuses to complete the activity, clinicians would code this activity 07. 09 being not applicable, so it was not attempted and the patient did not perform this activity prior to the current illness, exacerbation, or injury. 10 being not attempted due to environmental limitations. I'm from North Carolina. We get all 4 seasons. We get tornadoes, we get hurricanes, we get snowstorms. So if there is a lack of equipment or weather constraints for one of the activities, you would code 10 not attempted due to environmental limitations, and we'll discuss that in just a minute too. Or the last one is code 88, not attempted due to medical conditions or safety concerns. So here's a provider Q&A that we've received, and it's, can you provide scenarios in which a patient would be scored 10 for an item? And our answer is we do not expect code 10 not attempted to be due to environmental limitations to be used often. If a patient is unable to go outside due to inclement weather, such as snow or cold temperatures, and no indoor option for uneven surfaces is available, code the activity GG0170L, walk 10 feet on uneven surfaces with a code 10, not attempted due to environmental limitations. For GG0170R, wheel 50 feet with 2 turns. If the patient is obese, and you do not have a wheelchair that is the appropriate size for the patient, you would code 10, not attempted due to environmental limitations due to the lack of equipment. All right, we're going to watch a video now on the decision tree, and there is a decision tree also in all of your folders. I would encourage you guys to pull that out and use it as we go through the coding scenarios. It can prove to be very helpful when making decisions about the coding scenarios.
We will walk through the decision tree for coding GG0130, self-care, and GG0170, mobility, highlighting each coding level using an example of a patient, Mrs. Jones, completing GG0170D, sit to stand. The decision tree presents a series of yes-no questions, represented by diamonds, that guide you to the correct code for your patient or resident. Accurate coding is important to capture patient and resident safety, appropriate goal setting, and accurate evaluation of the patient's or resident's functional ability at discharge. The first question in the decision tree asks, does the patient or resident complete the activity, with or without assistive devices, by him or herself and with no assistance, including physical, verbal, or nonverbal cueing, setup, or cleanup? If the answer to this question is yes, the correct code for this patient or resident is 06 independent. Let's view an example of Mrs. Jones completing the sit-to-stand activity independently. In this scenario, Mrs. Jones is sitting up on the side of the bed. She retrieves her walker and places it in front of her. Then, she safely rises to a standing position. Once standing, she holds on to the walker to steady herself. There is no assistance provided by a helper. If, however, the answer to this first question is no, the patient or resident is not able to complete the activity by him or herself without assistance, proceed to the next question. The second question in the decision tree asks, does the patient or resident need only setup or cleanup assistance from one helper? If the answer to this question is yes, the correct code for this patient or resident is 05, setup or cleanup assistance. Let's review an example of the same patient, Mrs. Jones, completing the sit-to-stand activity, but this time with setup or cleanup assistance. In this scenario, Mrs. Jones is sitting up on the side of the bed. She retrieves her walker and places it in front of her. Then, a helper raises the bed rail. Mrs. Jones grasps the bed rail and safely rises to a standing position. Once standing, she holds onto the walker to steady herself. In this example, the patient completes the activity by herself with setup assistance. Setup assistance is demonstrated by the helper raising the bed rail. So you would code this 05 setup or cleanup assistance. If, however, the answer to this question is no, the patient or resident requires more than setup or cleanup assistance to complete the activity, proceed to the next question. The third question in the decision tree asks, does the patient or resident need only verbal or nonverbal cueing, or steadying, touching, or contact guard assistance from one helper? If the answer to this question is yes, the correct code for this patient or resident is 04, supervision or touching assistance. Let's review an example of the same patient, Mrs. Jones, completing the sit-to-stand activity, but this time with supervision or touching assistance. In this scene, Mrs. Jones is sitting up on the side of the bed. She retrieves her walker and places it in front of her. Then, a helper raises the bed rail and provides cues for hand placement.
I'm going to tell you how to do it safely.
The helper also provides instructions to help Mrs. Jones safely rise to a standing position. Once standing, Mrs. Jones holds onto the walker to steady herself. In this scenario, Mrs. Jones needs verbal and nonverbal cueing from one helper, so you would use code 04, supervision or touching assistance. If, however, the answer to this question is no, the patient or resident requires more than supervision or touching assistance to complete the activity, proceed to the next question. The fourth question in the decision tree asks, does the patient or resident need physical assistance, for example, lifting or trunk support, from one helper with the helper providing less than half of the effort? If the answer to this question is yes, the correct code for this patient or resident is 03, partial moderate assistance. Let's review an example of Mrs. Jones completing the sit-to-stand activity, but this time with partial moderate assistance. In this scene, Mrs. Jones is sitting up on the side of the bed. She retrieves her walker and places it in front of her.
Mrs. Jones.
Oh, good morning.
A helper raises the bed rail, secures a gait belt around her waist, and provides instructions regarding the transfer.
One hand on the rail. You're going to put one hand on the bed. We're going to go on the count of 3, all right?
Then, while holding Mrs. Jones, the helper provides a slight upward boost using the gait belt. Mrs. Jones, who is bearing most of the weight, rises safely to a standing position. In this example, Mrs. Jones needs physical assistance with the helper providing less than half of the effort, so you would code this 03, partial moderate assistance. If, however, the answer to this question is no, the patient or resident requires more than partial moderate assistance to complete the activity, proceed to the next question. The fifth question in the decision tree asks, does the patient or resident need physical assistance, for example, lifting or trunk support from one helper, with the helper providing more than half of the effort? If the answer to this question is yes, the correct code for this patient or resident is 02, substantial maximal assistance. Let's review an example of the same patient, Mrs. Jones, completing the sit-to-stand activity, but this time with substantial maximal assistance. In this scene, Mrs. Jones is sitting up on the side of the bed. She retrieves her walker and places it in front of her. A helper raises the bed rail, secures a gait belt around Mrs. Jones' waist, and provides instruction regarding the transfer.
We're going to work together.
Okay.
Okay, on the count of 3.
3.
Okay?
Using the gait belt, the helper lifts Mrs. Jones, bearing most of her weight during the transfer.
1, 2, 3.
The helper provides continual assistance as she moves Mrs. Jones to a standing position. In this scenario, Mrs. Jones needs physical assistance with the helper providing more than half of the effort, so you would code this 02, substantial maximal assistance. If, however, the answer to this question is no, the patient or resident requires more than substantial maximal assistance from one helper to complete the activity, proceed to the next question. The sixth and final question in the decision tree asks, does the helper provide all the effort to complete the activity, or is the assistance of 2 or more helpers required to complete the activity? If the answer to this question is yes, the correct code for this patient or resident is 01, dependent. Let's review a final example of the same patient, Mrs. Jones, completing the sit-to-stand activity, but this time the patient is dependent on 2 helpers to complete the activity. In this scene, 2 helpers are assisting Mrs. Jones. One helper secures a gait belt around Mrs. Jones' waist, while the other helper provides instructions about the transfer.
On 3, we're going to stand up. 1, 2, 3, all the way up tall.
Both helpers provide continual assistance as they move Mrs. Jones to a standing position, using the gait belt to fully support her weight. Once standing, Mrs. Jones holds onto the walker to steady herself. In this scenario, Mrs. Jones needs the physical assistance of 2 or more helpers to complete this activity, so you would code this 01 dependent. This video provided you with an overview of the decision tree for coding GG0130 self-care and GG0170 mobility. We reviewed a series of key coding questions to help you identify the correct code for your patient or resident. Accurate coding is important to capture patient and resident safety, appropriate goal setting, and accurate evaluation of the patient's or resident's functional ability at discharge. We hope you found this video helpful. For more information on coding section GG, refer to your setting-specific guidance manual that can be found on the CMS website.
Okay. So hopefully that video was helpful. And again, the decision tree document is also in your packet. So good to have those questions handy when answering example scenarios and to take back as well to your facilities. So general coding tips for GG0130 and GG0170, when reviewing the patient's medical record, remember that interviewing staff and observing the patient, you should be familiar with the definition of each activity. You want to code based on the patient's performance, so do not record what a staff member's assessment is of the patient's potential capability to perform the activity. To clarify your own understanding of the patient's performance of an activity, you should ask probing questions to the care staff about the patient, beginning with the general and proceeding to more specific questions. Documentation in the medical record is used to support assessment coding of section GG, and data entered should be consistent with the clinical assessment documentation in the patient's medical record. Again, use of assistive devices to complete an activity should not affect the coding of the activity. So if a patient uses an adaptive equipment and uses the device independently when performing the activity, they can be coded 06 independent. And if the only help a patient needs to complete an activity is for a helper to retrieve an assistive device or adaptive equipment, such as a cane for walking, then you would code this scenario 05 setup or cleanup assistance. Anytime 2 or more helpers are required, that's an immediate indicator that the activity would be coded 01 dependent. So quickly, I want to touch on incomplete stays. For patients with incomplete stays, such as a patient with an emergency discharge, the self-care and mobility items are skipped. Patients with incomplete stays include patients who unexpectedly discharged to an acute care setting, and that can be a short-stay acute care hospital, critical access hospital, inpatient psychiatric facility, or long-term care hospital. Patients who die or leave the IRF against medical advice, or patients with a length of stay for less than 3 days. Okay, again, pull out your Slido so we can do this question. So which example best demonstrates allowing the patient to function as independently as possible? Your choices are A, feeding a patient who can feed himself in order to expedite mealtime. B, allowing the patient to brush her teeth as much as possible, assisting only if she becomes fatigued. C, providing the patient with a bedside commode when he is capable of walking to the bathroom with assistance, or D, all of the above. So I'll give you guys just a couple more seconds to put in your responses. Seeing some movement. All right, so we'll go ahead and take a look at the correct answer now. And the correct answer is B, allowing the patient to brush her teeth as much as possible, assisting only if she becomes fatigued. Of course, the rationale behind that is as much as possible, the clinician should support the patient's goal towards independence. Doing so, allowing the patient to participate in the activity to the full extent possible, only receiving assistance from the caregiver as needed. Patients should be allowed to perform the activity as independently as possible as long as they are safe. And facility staff and/or families should allow independence whenever possible to promote quality of life and a sense of well-being. Okay, so one more question for Slido. Since Mr. W uses a quad cane, he cannot be considered independent for the section GG walking items. Is this A, true, or B, false? And we'll go ahead and look at this, the correct answer now, and it is B, false. Again, the rationale, activities can be completed with or without assistive devices, and use of assistive devices to complete an activity should not affect coding of an activity. All right, so now we're going to go into item-specific guidance for GG0130 self-care and do some practice scenarios. And again, all of these will be on Slido. There are a couple more videos as well, so you'll have an opportunity to do that too. So this is what section GG, Functional Abilities and Goals, GG0130 self-care looks like on the IRF-PAI. Again, it's the 3-day assessment period. You have a column for admission performance and a column for discharge goal. And we're going to go through each of the items now. So the first one is GG0130A, eating. And eating is the ability to use suitable utensils to bring food and or liquid to the mouth and swallow food and or liquid once the meal is placed before the patient. So just some tips for eating. If a patient receives tube feedings or parenteral nutrition, assistance with tube feedings or parenteral nutrition is not considered when coding the item eating. If the patient does not eat or drink by mouth and relies solely on nutrition and liquids through tube feeds or PN due to a new, and that's a recent onset medical condition, code GG0130A as 88, not attempted due to medical conditions or safety concerns. If the patient does not eat or drink by mouth at the time of the assessment, and the patient did not eat or drink by mouth prior to the current illness, injury, or exacerbation, GG0130A would be coded 09, not applicable. And if the patient eats and drinks by mouth and relies partially on obtaining nutrition and liquids via tube feedings or PN, code eating based on the amount of assistance the patient requires to eat and drink by mouth. All right, so here's our first Slido practice scenario with this one. For the past 2 years, Ms. T has been unable to eat or drink by mouth due to a swallowing disorder and a history of aspiration pneumonia. She uses a gastrostomy tube or G-tube to obtain nutrition. Ms. T had a stroke 8 days ago, and her IRF admission orders include nothing by mouth or NPO and G-tube feedings. So how would you code GG0130A? Your choices are A, 01, dependent, B, 02, substantial or maximal assistance, C, 09, not applicable, or D, 88, not attempted due to medical condition or safety concerns. And again, you can use the decision tree to kind of help ask the questions that you should be asking. And we'll go ahead and look at the correct answer now. Several of you have actually chosen the correct one, so it's code 09, not applicable. The rationale being Ms. T does not eat or drink by mouth at the time of admission assessment, and she did not eat or drink by mouth prior to the current illness injury or exacerbation. Eating includes only eating by mouth, and assistance with G-tube feedings or PN are not considered when coding the item eating. Okay, next we have oral hygiene, GG0130B, and this is the ability to use suitable items to clean teeth. Dentures, if applicable, the ability to insert and remove dentures into and from the mouth and manage denture soaking and rinsing with the use of equipment. And we're going to watch a quick video and practice coding it at the end.
Here you see the helper providing steadying assistance to Mr. Smith as he walks to the bathroom using his walker. Once in front of the bathroom sink, the helper applies toothpaste to Mr. Smith's toothbrush and leaves the room. Mr. Smith then brushes his teeth without supervision. Once Mr. Smith is done brushing his teeth, the helper re-engages by cleaning and putting away the oral hygiene items. The helper then provides steadying assistance to Mr. Smith as he walks back to bed.
Okay, so this one isn't a Slido one, but we're just going to quickly go through what the coding and rationale would be, and then you guys will have an opportunity to do Slido for GG0130B. So in this situation, GG0130B oral hygiene would be coded O5, setup or cleanup assistance, because the helper provides setup assistance by putting toothpaste on the patient's toothbrush, and cleanup assistance by putting away the supplies after Mr. Smith completes the activity. Again, because we're coding oral hygiene, we're not going to consider the assistance provided to get to or from the bathroom when coding this item. All right, so this one you guys are actually going to practice coding on Slido, so we'll do the video first.
Here you see the helper providing assistance to Mr. Smith as he walks to the bathroom. Once in front of the bathroom sink, the helper retrieves and puts toothpaste on Mr. Smith's toothbrush and hands it to him. The helper then steadies Mr. Smith's arm as he brushes his teeth. Once Mr. Smith is finished brushing his teeth, the helper rinses his toothbrush and puts it away. The helper then provides steadying assistance as Mr. Smith walks back to bed.
So based on that video, how would you code GG0130B? Your options are A, O5, setup or cleanup assistance, B, O4, supervision or touching assistance, C, O3, partial or moderate assistance, or D, O2, substantial or maximal assistance. Several of you saying O4. Give you guys just another couple seconds to put in your responses. Maybe use your decision trees. Okay, let's look at the correct answer now. And it is O4, supervision or touching assistance. The rationale being Mr. Smith required the helper to provide supervision and touching assistance in order to complete the activity of oral hygiene. Again, we're not considering the assistance getting to and from the bathroom since we're coding oral hygiene. Okay, next is GG0130C, toileting hygiene. This is the ability to maintain perineal hygiene, adjust clothes before and after voiding or having a bowel movement. If managing an ostomy, include wiping the opening but not managing the equipment. So, Mr. W uses a urinal when voiding, and completes toileting hygiene tasks without assistance while sitting on the side of the bed. He uses a toilet with a raised toilet seat when moving his bowels and requires contact guard assistance from the helper as he holds onto a grab bar with one hand, lowers his underwear and pants, performs perianal hygiene, and then pulls up his underwear and pants. So based on this, I see several of you using your decision tree. That makes me really happy. How would you code GG0130C? Your choices are A, O2, substantial or maximal assistance, B, O3, partial or moderate assistance, C, O4, supervision or touching assistance, or D, O6, independent. All right, give you guys just a couple more seconds. And we'll go ahead and take a look at the correct answer now. And it is O4, supervision or touching assistance. Rationale being, of course, the helper provides contact guard assistance as the patient completes the activity. Okay, next we have GG0130E, and that's shower, bathe, self. And this is the ability to bathe self, including washing, rinsing, and drying self. It does exclude washing of the back and hair, and it does not include transferring in and out of the shower, tub or shower. Here are some tips on coding GG0130E. The assessment can take place in a shower or bath or at a sink. So for example, a full body sponge bath. If the patient bathes himself or herself and a helper sets up materials for bathing or showering, then code O5, setup or cleanup assistance. If the patient cannot bathe his or her entire body because of a medical condition, code based on the type and amount of assistance needed to complete the activity. So here's our practice coding scenario. Miss N declines to shower herself when the occupational therapist attempts to complete the assessment. The therapist asks Miss N's CNA detailed questions about Miss N's ability to shower or bathe herself and considers this input when coding the activity. The therapist learns that Miss N takes a shower and initiates washing her face, arms, chest, part of her legs, and perineal area. She requires assistance to wash, rinse, and dry her lower extremities below the knees. Miss N rinses and dries most of her body. So when coding the scenario, again, try to look back at the definition, remembering what the definition is. Your options to code GG0130E are A, O4, supervision or touching assistance, B, O3, partial or moderate assistance, C, O2, substantial or maximal assistance, or D, O1, dependent. Looks like we're getting overwhelming responses for B. Okay, we'll go ahead and take a look at the correct answer now. And it is B, O3, partial or moderate assistance. The rationale being, of course, the helper provides less than half the efforts for Miss N to complete the activity of shower or bathe herself. During the 3-day assessment period, the therapist does not observe the patient bathing and asks other clinicians and care staff about Miss N's abilities to determine her abilities. Okay, next we have GG0130F, upper body dressing, and this is the ability to dress and undress above the waist and include fasteners if applicable. So we've listed some items for upper body dressing items, but this is not an all-inclusive list. Upper body dressing examples include a bra, undershirt, t-shirt, button-down shirt, pullover shirt, sweatshirt, sweater, pajama top, TLSO, abdominal binder, back brace, a stump sock or shrinker, an upper body support device, neck support, or hand or arm prosthetic or orthotic. So here's our practice coding scenario for Slido. Mr. T has reduced strength and range of motion in both upper extremities following spinal surgery, and he wears a cervical collar. The nurse puts on the cervical collar. Once Mr. T is sitting at the side of the bed, he threads his hand into the sleeve of his shirt, and due to his no twisting precautions, the nurse pulls the shirt across his back and threads his other hand into the shirt sleeve. The nurse also pulls up the shirt over both shoulders. Mr. T buttons 2 of his shirt buttons, and the nurse buttons the last 3. So based on this information, how would you code GG0130F? Would you say A, O4, supervision or touching assistance, B, O3, partial or moderate assistance, C, O2, substantial or maximal assistance, or D, O1, dependent? Several of you still submitting votes. I'm seeing jumps. And a lot of people voting for C. All right, let's go ahead and take a look at the correct answer. And it is, in fact, C, O2, substantial or maximal assistance. Mr. T threads one arm into his shirt sleeve and buttons up some of his buttons. The nurse assists Mr. T by applying the cervical collar and helping him pull his shirt around his back, threading his other arm, pulling it over his shoulder, and buttoning the other buttons. For dressing items, consider donning and or doffing an orthosis or prosthesis or other devices such as a piece of clothing when dressing or undressing. All right, we're going to move on to lower body dressing now, and that's GG0130G. And this is the ability to undress items below the waist, including fasteners, and it does not include footwear. So again, some examples of lower body dressing items. Again, this is not an all-inclusive list. The examples are underwear, incontinence briefs, slacks, shorts, capri pants, pajama bottoms, skirts, knee braces, elastic bandages, stump socks or shrinkers, or lower limb prosthesis. So here's our coding example for GG0130G. Mrs. R has peripheral neuropathy in her upper and lower extremities. Mrs. R needs assistance from a helper to place her lower limb into and take it out of her lower limb prosthesis. She gets no assistance to put on and remove her underwear or slacks. So based on this information, how would you code GG0130G? Your options are A, O2, substantial or maximal assistance, B, O3, partial or moderate assistance, C, O4, supervision or touching assistance, or D, O6, independent. Some people changing their mind, jumping ship, it looks like. Give you guys just a couple more seconds to submit your codes. All right, let's go ahead and take a look at the correct answer. And it is B, O3, partial or moderate assistance. A helper performs less than half the effort of lower body dressing. Assistance with lower extremity prosthesis is considered when coding lower body dressing. So that's why the answer is O3, partial or moderate assistance. Finally, in section GG self-care, we have GG0130H, putting on or taking off footwear. The definition, of course, being the ability to put on and take off socks and shoes or other footwear that is appropriate for safe mobility, including fasteners if applicable. Here are some examples of footwear items. Again, not an all-inclusive list, but socks, shoes, boots, running shoes, an AFO, elastic bandages, foot orthotics, orthopedic walking boots, or compression stockings. Here's our coding scenario for GG0130H. So Mr. Q underwent bilateral below-the-knee amputations 3 years ago. He uses a bilateral limb prosthesis with attached shoes and socks that he never changes. Prior to the current episode of care at the acute care hospital and during his IRF stay, he does not perform the activity of putting on and taking off footwear. So, how would you code GG0130H? Would you say A, O1 dependent, B, O9 not applicable, C, 88 not attempted due to medical conditions or safety concerns, or D, patient refused? 07, patient refused. Give you guys just a couple more seconds. It looks like guys are getting these all right, so that's good. All right, and we're going to look at the correct answer now, and it is 09, not applicable. The rationale being patients with bilateral lower extremity amputations with or without use of prosthesis, the activity of putting on and taking off footwear may not occur. Mr. Q's socks and shoes were attached to his prosthesis. Mr. Q did not perform putting on and taking off footwear prior to the current illness, exacerbation, or injury, and the activity was not performed during the assessment period in the facility. So just a quick note, if a patient has a recent bilateral leg amputations and completes putting on and taking off footwear immediately prior to the current illness, exacerbation, or injury, then the applicable code is 88, not attempted, due to medical condition or safety concerns. Okay, so on the IRF-PAI, you also see the same column that says discharge goal under GG0130 self-care discharge goal, and this is where you would complete the discharge goal based on the activities. For discharge goal coding tips, we say you should code the patient's discharge goals using the 6-point scale that we just went through, and one of the activity not attempted codes, 07, 09, 10, or 88. For the IRF-QRP, at least one goal must be indicated for either self-care or mobility. You can use a dash to indicate that a specific activity is not a goal. And using a dash in this allowed instance does not affect APU determination. So licensed clinicians can establish a patient's discharge goals at the time of admission. These are based on multiple factors, including the patient's prior medical condition, prior and current self-care and mobility status. Again, those discussions with the patient and their family members concerning their discharge goals. The professional's standard of practice or scope of practice. The expected treatments. The patient's motivation to want to improve, and the anticipated length of stay. Goals should be co-created and established as a part of the patient's care plan. By co-created, we mean the patient should have just as much input into the goal as the clinician. Continuing on with the tips, discharge goals may be coded the same as admission performance, higher than admission performance, or lower than admission performance. And if the admission performance and activity was coded using one of the activity not attempted codes, so that's 07, 09, 10, or 88, a discharge goal may be submitted using the 6-point scale if the patient is expected to be able to perform the activity by discharge. Okay, we're going to go a little bit into mobility and then we'll take a break. So same thing, same setup as GG0130, only it's mobility. Do the 3-day assessment period. This is what it looks like in the IRF-PAI again, the 2 columns. And this is a continuation of that. So first we have GG0170A through GG0170C, and these are the bed mobility items. So GG0170A is roll left to right, and the definition of this is the ability to roll from lying on back to left and right side and returning to lying on back on the bed. Just some coding tips for bed mobility items. If the clinician determines that bed mobility cannot be assessed because of the degree to which the head of the bed must be elevated because of a medical condition, then code activities GG0170A, roll left and right, GG0170B, sit to lying, and GG0170C, lying to sitting on side of the bed as 88, not attempted due to medical condition or safety concern. For GG0170A through GG0170C, clinical judgment should be used to determine what is considered a lying position for the patient. For example, a clinician could determine that a patient's preferred slightly elevated resting position is lying for that patient. So we've got a practice coding scenario for GG0170A. Miss W's head of the bed must remain slightly elevated at all times due to aspiration precautions. Although the head of the bed is slightly elevated, the therapist determines that she can assess Miss W's ability to roll left and right. The therapist provides verbal instructions as Miss W completes the activity. So based on that information, again using Slido, how would you code GG0170A? Would you say A, 05, setup or cleanup assistance, B, 04, supervision and touching assistance, C, 09, not applicable, or D, 88, not attempted due to medical condition or safety concerns? Give you guys just a couple more seconds. All right, and let's go ahead and take a look at the correct answer now. So the correct answer is 04, supervision and touching assistance. And the rationale behind that is Ms. W requires verbal instructions while rolling left and right in bed. The assessment definition includes lying on back. In this example, the clinician uses clinical judgment and determines that the assessment can be conducted with the head of the bed slightly elevated. Okay, next we have GG0170B, sit to lying. And the definition of this item is the ability to move from sitting on the side of the bed to lying flat on the bed. So here's our example. Mr. P has peripheral vascular disease and recently had a right above the knee amputation. Mr. P requires the physical therapist to perform steadying assistance as he moves from a sitting position to lying down. So again, how would you code GG0130B? Your choices are A, 05, setup or cleanup assistance, B, 04, supervision or touching assistance, C, 03, partial or moderate assistance, or D, 09, not applicable. You guys are on your A game this morning. You're getting all of them right. So let's go ahead and take a look at the correct answer. And it is B, 04, supervision or touching assistance. The rationale being that the helper provided only steadying assistance as Mr. P performed the activity. Next, we have GG0170C, lying to sitting on the side of the bed. And the definition for this item is the ability to move from lying on the back to sitting on the side of the bed with feet flat on the floor and with no back support. Some coding tips for this item If a patient's feet do not reach the floor upon lying to sitting, the clinician will determine if a bed height adjustment or a footstool is required to accommodate foot placement on the floor or footstool. And back support in the definition refers to an object or a person providing support of the patient's back. So we're going to watch a video and we'll code it immediately following this.
Hi, Mrs. Brown. How are you today?
I'm doing a little better, thanks.
Good. Can you come sit on the side of the bed for me?
It's hard, but I'll try. Oh, could you help with my legs?
Of course. Good job.
Thank you.
So in this coding scenario, lying to sitting on the side of the bed would be coded O3, partial or moderate assistance. As Mrs. Brown begins to move to a seated position, the clinician assisted with pivoting Mrs. Brown's legs to the side of the bed and provided assistance that represents less than half of the effort required to complete the activity. Therefore, it would be O3, partial or moderate assistance. Okay, we have one more video in which you guys will actually participate on slide.
Hi, Mrs. Brown. How are you today?
I'm doing a little better, thanks.
Good. Can you come sit on the side of the bed for me?
It's hard, but I'll try.
Looks like you're struggling a bit. Can I help you?
Yes, thanks.
Okay, first, let me have you try to lie on your side. Great. Now, put your hand on the bed and push yourself up. As you do that, I'm going to put my hand on your upper back and arm and swing your legs until you're in a seated position. Is that okay?
Sure, let's give it a try.
Good job.
Thanks.
Okay, so based on that video, how would you code GG0170C? Your choices are A, O4, supervision or touching assistance, B, O3, partial or moderate assistance, C, O2, substantial or maximal assistance, or D, O1, dependent. Okay, and let's go ahead and take a look at the correct answer. The answer is O2, substantial or maximal assistance. The rationale being, of course, that Mrs. Brown required the clinician to provide lifting and physical assistance that represents more than half of the effort to complete the activity of moving from lying on her back to sitting on the side of the bed. So we are going to break at this point, just to have a good place, a good stopping place, and I'll turn it over to Bridget. And thank you so much again for your time and attention today.
So my name is Anne, and I will pick up where Manisha left off, talking about the mobility activities. So the first set of items that we're going to talk about are the transfer items. Let's see. So the first one is sit to stand. So sit to stand is defined as the ability to come to a standing position from sitting in a chair, wheelchair, or other on the side of the bed. So we do have some practice scenarios similar to what you were working with Manisha. And again, I would encourage you to look at the definitions if you have a copy of the manual with you, or if you have the decision tree, I'll actually help walk through that so that you can kind of know how to use that a little bit more. So we have a scenario here. Mrs. P is morbidly obese and has severe arthritis in both knees. She is unable to transition from sit to stand without the use of a mechanical lift. Mrs. P lifts and places her feet on standing lift device to initiate the activity. Assistance from 2 helpers is required as Mrs. P is helped to transition from a sitting to a standing position. So if you can pull out Slido, please think about how you would code Mrs. P. And you do have a copy of all these practice scenarios in your packet. If you find it we're changing the slides too quickly, please do look at your packets, or if you're online, you can look at the materials that are posted. So the options on Slido are that the Ms. P is a level 2 substantial maximal assistance, code 1 dependent, code 9 not applicable, or code 88 not attempted due to medical condition or safety concern. Okay, I see a fair number of people are still entering their codes. And there's, as Bridget said, there's a bit of lag for people online, so I'll just wait a second here for people to code. And just, I guess, as an example of using the decision tree, so obviously if you were working through the decision tree, there is assistance being provided. It's more than setup assistance. It's more than touching assistance. It's more than lifting assistance where the helper is doing less than half of the effort. With one helper, it's more assistance than just one helper providing more than half the effort, and so hopefully that'll help you. And one thing I do want to highlight to help you with this one a little bit is that in the decision tree, you'll notice that before you get to level 1, you always see one helper being identified. So if there's 2 helpers required, you're always actually going to be coding dependent. So in the case where the patient is doing a little bit of the effort and you want to give them credit, but there's actually 2 helpers required, it's going to default to level 1. So with that, we will see what the answer is. So if we can move to the next slide. And as you can see, in this case, the correct answer is 1 dependent, because although Mrs. P placed her feet on the mechanical lift, so she did a little bit of effort, but because there's 2 helpers required, it did default to level 1. So I hope that is a helpful example of how the decision tree can be used to help you do some coding. So again, if assistance of 2 or more helpers is required, you would always be coding level 1. The next activity that we're going to be talking about is chair to bed transfer. And with this one, the definition is the ability to transfer to and from a bed and or wheelchair, and it could be a wheelchair if that's what the patient uses. So we do get a lot of questions through our help desk, and I do want to thank all of you who submit those questions and all the questions that we get through training. We do try and actually put coding tips into the manual to try and address some of the questions, and actually some of the examples that you see here were inspired by some of your questions. So in fact, that last example was one that we created to help address the issue of 2 helpers. So in this case, for coding tips for bed chair transfer, and these are in the training manual. So the activities of sit to lying and lying to sitting on side of bed are 2 separate activities and are not assessed as part of GG 0170E. If a mechanical lift is used to assist in transferring a patient from a bed chair transfer with 2 helpers needed to assist with the mechanical lift transfer, then you would code level 1 dependent, even if the patient assists with part of the bed chair transfer. So we do have another coding scenario here. So Mr. L, in this instance, is our patient, and he has spinal stenosis, and due to back pain, does not fully stand up. He uses a stand pivot style transfer from bed to chair and bed to chair during the 3-day assessment period. The occupational therapist uses a gait belt around Mr. L's waist, providing initial lifting assistance from the chair or bed as he raises himself to a stooped over position. The therapist continues to steady him as he completes a pivot, turns, and then lowers himself into the chair. Mr. L contributes more than half of the effort. So if you were thinking through the decision tree, you would first off start, is more than setup assistance from 1 helper being provided? Of course, the answer is yes. So then you would say, is it just steadying, contact guard, touching, supervision assistance, or is it more? You would go down to the next level, and basically, if there's lifting assistance, it's going to be level 3 or below. So let's go to Slido and see how you would code that. The options are A, the patient would be coded 4, supervision or touching assistance. The person would be coded 3, partial or moderate assistance. Code 2, substantial maximal assistance, or code 1, dependent. And I will give you a few more seconds to code. Okay, all right. Let's go ahead and see the answer. So in this case, for question 15, you are correct. Most of you coded 3 partial moderate assistance. The rationale for the code 3 in this instance is that Mr. L requires a helper to initially provide lifting assistance during the transfer and provides less than half of the effort. It is acceptable if the patient is only able to rise partially and then pivot, turn, and sit on the chair or bed or wheelchair to perform this activity. The next activity is toilet transfer, and toilet transfer refers to the ability to get on and off a toilet or commode. And just again, some coding tips based on some of the questions that you've submitted in the past. Do not consider or include GGO 130, toileting hygiene item tasks, as you're actually assessing getting on and off the toilet. Those certainly will happen together, but in your mind, think about those as separate activities. It is certainly possible that you're providing, let's say, steadying or touching assistance as the patient is performing toileting hygiene activities, pulling pants up and down, as well as getting on and off the toilet, and both would be coded level 4 in that instance if that's the only level of assistance required. Transferring on and off a bedpan is not included in toilet transfer. It would either be getting on and off a toilet or getting on and off a commode. Could be a raised toilet seat or not a raised toilet seat. So we have a scenario number 14 here. Miss M had a total hip replacement following a hip fracture and was in an acute care hospital prior to being transferred to the inpatient rehabilitation hospital. While in acute care, she started to use a raised toilet seat. When Mrs. M needs to void, the certified nursing assistants provide steadying assistance as Miss M transfers safely from the wheelchair onto the raised toilet seat. So what do you think Miss M ability level would be? If you can enter your codes in Slido, the options are level 5, setup or cleanup assistance, level 4, supervision or touching assistance, level 3, partial moderate assistance, or 09, not applicable. Okay, it looks like there's still some people who are coding, so I will give you another few seconds. Okay, it's starting to slow down now, so I think we can go ahead and move to the answer. So the correct response, as most of you correctly indicated, is 04, supervision or touching assistance. In this example, the rationale, the certified nursing assistant provides only steadying assistance during the activity. The raised toilet seat is used during the initial assessment and was previously used in the acute care hospital. The next activity is car transfer. So car transfer refers to the ability to transfer in and out of a car or van on the passenger side. It does not include the ability to open and close the door or to fasten seatbelts. So it's literally just the transfer getting into and out of the passenger seat. So we've had a lot of questions about this particular activity, and so I just wanted to review a few coding tips with you. Use of an indoor car can be used to simulate outdoor car transfers. These half or full car transfers would need to have similar physical features of a real car. So, for example, a car seat within a car cabin. We've had actually a lot of different questions. Can you use a golf cart? Can you use this? Can you use that? You'd be using your clinical judgment basically to do the best, simulation if that's what you need to do. Obviously, if it's possible for, when the family visits, if you're able to actually practice with the car that the person will be using after discharge, that's obviously an option too. Car transfers does not include transfers into the driver's seat, opening and closing the car door, or fastening or unfastening seatbelt. If you are doing this in an outside area or maybe in a open parking garage and the weather is bad, certainly that can happen with this particular activity. You can, so if there's inclement weather and an indoor car simulator is not available, then if that happens during, let's say, the last 3 days of the patient's stay, you can code 10 not attempted due to environmental limitations. So that's certainly possible. Okay, moving on to the next slide, we do have another scenario. So here, when performing car transfers, Mr. T, who recently had hip surgery, requires significant support from the physical therapist as he transitions into the passenger seat of the car to maintain his hip precautions. Once seated, Mr. T places his left leg into the car and requires assistance to lift his right leg into the car. When transferring out of the car, Mr. T requires significant physical lifting assistance from the therapist, and the therapist lifts his right leg out of the car. Mr. T lifts his left leg out of the car. So if you're thinking through the decision tree, does he require more than setup assistance from one helper? Yes. And so does he require more than touching? Does he require more than lifting assistance where the helper is providing less than half of the effort, or is the helper providing more than half of the effort? So based on that, you can go ahead and code on Slido. The options that you have for Slido, let's see. So I think Slido is going to come up any second now. There we go. So the response options for Slido are 5 setup cleanup assistance, 4 supervision or touching assistance, 3 partial moderate assistance, 2 substantial maximal assistance. So again, you're taking into account or considering who is putting in more than half of the effort. If the patient is providing more than half of the effort, be level 3. If the helper is providing more than half of the effort, it's level 2. Okay, it looks like most people have gotten in their codes at this point. So we'll go ahead and see what the correct answer is. And it is indeed 2, which is what most of you coded. The rationale here is that the helper provides lifting assistance more than half of the effort to assist Mr. T getting into and out of the car. Mr. T lifts his left leg in and out of the car. Okay, moving on to the walking items. As you know, there's various walking items. So the first walking item that we're going to be talking about is a short distance, 10 feet. So this can be assessed in the patient's room as well as in the therapy gym or in the hallway. And this, with all the walking items, the patient would actually begin in a standing position. So once standing, walking 10 feet refers to the ability to walk at least 10 feet in a room, corridor, or similar space. I do want to highlight that there is a skip pattern related to this item, and in fact, we have a slide specifically addressing this. So if the patient is not able to walk 10 feet, so that means that you may be coding either a 7, meaning the person refused, 09, it was not applicable, meaning that the person did not perform the activity at the time of assessment, and the person did not perform that activity prior to the current exacerbation, illness, or injury. So for example, you may have an individual who is admitted who had a spinal cord injury 10 years ago, been using a wheelchair to mobilize, and they are the individual is admitted to your facility, so they did not walk prior to the current event that's triggering the admission. Let's say they have some functional decline and maybe pressure ulcer. So the person on the initial assessment for GG for walking would be coded 09 here. The other option is it could be a code 10, meaning there's environmental limitations, which probably shouldn't be used that much for this. Manisha, I think, addressed that in one of the Q&As. And then 88 is actually the most common reason that you might be coding activity not attempted for 10 feet. So if you are coding that the patient is not able to walk 10 feet, so if somebody perhaps is walking 7 feet or not able to walk at all, you actually then by coding one of these activity not attempted codes, will skip out of the remaining walking items. Basically, the logic there, if the person can't walk 10 feet, they're not able to walk 50 feet or 150 feet. So the intent is to reduce some burden. You do skip to the one-step curb because it is possible that somebody's using a wheelchair, and so the person is not walking 10 feet, but they're actually able to go up and down one step or a curb in a wheelchair. So I hope that makes sense. So just, I guess, to read the coding tip in the little box there, if the admission performance of an activity is coded, one of the activity not attempted codes, a discharge goal may be submitted using the 6-point scale if the patient is expected to be able to perform the activity at discharge. So we've had this question come in a lot. So it may be that you have a patient who on admission was not able to perform the activity, perhaps not able to, only able to walk 7 feet, but the goal is that person would be able to walk, let's say, 10 feet with touching assistance by discharge, so you can code a goal there. It is also possible in that prior scenario that I had where the individual uses a wheelchair, and so at discharge it's expected the person's still using the wheelchair, and so it's possible your admission code might be 09 for that person because they had this spinal cord injury from, I think, 10 years ago, and the goal may be that it's still not applicable because that's not what's being worked on in terms of the program. Okay, so some walking coding tips that relate to all the walking items. When assessing the patient for GG0170 walking items, do not consider walking in parallel bars because parallel bars cannot be, they're not portable. So if somebody's able to walk just in parallel bars and not able to walk outside of parallel bars, they're really restricted in their ability to walk. So that's a great question that we've had come in through the help desk and wanted to share that as a coding tip. If the patient cannot walk without the use of parallel bars due to his medical condition or safety concern, please code 88, not attempted due to medical condition or safety concern. A patient may take a standing breather break or brief break while walking 150 feet. Clinicians should use clinical judgment to define what a breather is. So you need to make a determination if you feel like the person took a brief pause and then, was able to complete the 150 feet. If the person needs to sit down while they're walking 150 feet, that doesn't count. So it needs to be a standing breather break, basically. Okay, so we do have another scenario here. Mr. S had an open reduction internal fixation on his left leg after a fall and is non-weight bearing on his left lower extremity. Mr. S walks 10 feet in the parallel bars with the physical therapist providing more than half of the effort to support his trunk. So he's not able to walk outside of parallel bars. So I think I gave you the answer to this one already, but we'll go to Slido and let's see if you were listening. So on Slido, the options that you have, that should come up any second. The options that you have are 01 dependent, 02 substantial maximal assistance, 3 partial moderate assistance, 88 not attempted due to medical condition or safety concern. So he had a recent event that basically he had the hip fracture, I think it was, and surgery, and so he's not going to be coded 99 because he was walking prior. So you have the options, again, 01, 02, 03, or 88 not attempted due to medical condition or safety concern. Okay, it looks like we have a few more responses coming in. Okay. All right, so let's see what the correct response is, and you are indeed correct, 88 not attempted due to medical condition or safety concern. Again, the rationale, Mr. S walks 10 feet in the parallel bars because he's not able to bear weight on his left lower extremity. The next activity is walk 50 feet with 2 turns, which refers to, again, the person starting in the standing position and refers to the ability to walk at least 50 feet and make 2 turns. If you have a question about what a turn is defined as a 90-degree turn. The two turns could be in the same direction. Those, let's say, 2 turns to the left or 2 turns to the right. The turns could also be in 2 different directions, so you may perhaps have a patient with a stroke, and so you assess them turning to the left and turning to the right. That's certainly acceptable also. The 90-degree turn should occur at the person's ability level and can include the use of assistive devices if they use it, for example, a cane, and the use of an assistive device does not increase or decrease the score. So we have another scenario here. This is number 17 if you're following in your packet. So here we have Mr. R. So Mr. R has chronic neurologic condition resulting in poor balance. He has used a walker for many years. Mr. R ambulates 50 feet with 2 90-degree turns requiring contact guard when he makes turns. So again, if you're thinking about the decision tree, how much help was provided, there's 1 helper, and it says that there's contact guard being provided. So you can go ahead and enter your responses into Slido, and the options for Slido are going to be coming up in just a sec. There they are. So the options for Slido that you can enter are level 5, setup or cleanup assistance, 4, supervision or touching assistance, level 3, partial or moderate assistance, 9, not applicable. Okay, it looks like there's still some answers coming in. Just give you another couple of seconds for those of you who are still doing it online. Okay, so I think we can go ahead to the answer now. All right, and indeed, most of you coded 4, and that is the correct answer. So the helper provides contact guard during the activity. So as I think many of you are aware, the code 4 includes supervision, any kind of touching assistance, so standby assistance, contact guard. There's lots of different terms, steadying assistance that you may be using in clinical practice, and those would all be coded level 4. The next activity is walk 150 feet. So this refers to walking 150 feet in a corridor or similar space. Again, it starts when the person is in an upright standing position. By the way, I think at this point I will mention some questions that we often get on help desk about walking and whether somebody has to complete the entire distance. And the answer is yes. So for walking, if the patient is only able to walk 50 feet or let's say 150 feet, the activity of walking 150 feet didn't occur. And that's because as a helper, the helper can't perform the activity for the person. And so we basically don't know how much help the person would need if the person went 150 feet. And that's different than the wheelchair items, where we will get to the wheelchair items soon. But with wheelchair items, it's possible for the person to wheel themselves, let's say 20 feet, 10 feet, and then the rest of the distance, a helper can assist with that. And so you're able to do an overall assessment of the effort required to complete the activity, because the activity can be completed wheeling 150 feet. So with going distances in wheelchair, somebody who goes and manages part of the distance, and you'll see this in examples, you can code based on that. But with walking, the person has to walk the entire distance. So either the 10 feet, the 50 feet with 2 turns, or the 150 feet for the activity to occur. And if the person is not able to go 150 feet, but let's say they can go 50 feet with 2 turns or 10 feet with 2 turns, 10 feet, the 10 feet and the 50 feet with 2 turns can be coded. The 50 feet would be coded one of the activity not attempted codes. There was another question that actually got submitted that I thought might be. Oh, sure. Say it again. Okay. So let's say we have a patient who can go 40 feet. So you would be able to assess how much assistance is needed to go 10 feet, right? Because they can go more than 10 feet. you would say that for 50 feet with true turns, they didn't meet the full distance, so they would get one of the activity not attempted codes. They did not go 150 feet. You're not doing that for them, so they would get coded activity not attempted. Does that help? Okay, great. Okay, I was going to give you another coding tip, but now I forgot it. Sorry. It'll come back to me. Okay, so we have another practice scenario. So here, Mr. T Miss T walks with her walker 150 feet independently as long as she takes a very brief standing rest break halfway through the walk. So if you can go to Slido, you will be coding her, again, 150 feet. She travels independently as long as she's able to take a brief standing break. So if you go to Slido, the options that you'll see on Slido are 06, independent, 05, setup cleanup assistance, 04, supervision or touching assistance, 09, not applicable. Okay, it looks like there's still quite a few responses coming in, so I will let that stay up there for just a few more minutes. Okay, looks like it's slowing down. So we can go ahead and go to the answer now, and indeed, most of you are correct, independent. So as I said before, breather breaks are allowed as long as it's standing. Use your clinical judgment to see if it's reasonable that the person completed the activity. The rationale, again, breather acceptable. The person didn't sit down, so it's an acceptable brief break. Okay, the next activity is walking 10 feet on uneven surfaces. So this refers to the ability to walk 10 feet on uneven or sloping surfaces. It could be indoor, it could be outdoor, it could be on turf or gravel. I know some rehabilitation hospitals have set up obstacle courses. I know, I live in Chicago. You can't walk down Michigan Avenue without a little bit of extra help to make sure your balance is good. And so obstacle courses are definitely, acceptable as part of a simulation. So we have an example here, scenario 19. Mr. B sustained an incomplete spinal cord injury after a car accident. He ambulates outside on grass and negotiates the turf with the therapist providing more than half of the effort to support his trunk. So if you can pull out Slido, you should see the response options there. And the options that you can code on Slido are 05, setup cleanup assistance, 04, supervision touching assistance, 03, partial moderate assistance, 02, substantial maximal assistance. Okay, still some responses coming in. Give you a few more seconds. Okay, it looks like it's slowing down. So most of you coded level 2. Let's see what the correct response is. Okay, let's see. The slides, is that advancing? Hang on a sec. Try it again. Oop. Okay, there we go. Thank you. Okay, so level 2 is the correct response, as many of you indicated. The rationale here being that the therapist provided more than half of the effort in order for the patient to ambulate 10 feet on an uneven surface. Okay, so now we're going to move to the stairs and pick up object activity. So the first activity is one step, and this refers to the ability to go up and down a curb and or one step. Similar to the walk item, we actually have a series of activities related to going up and down stairs. So there's 1 step, 4 step, 12 steps. So our thinking is that if the patient's not able to go up 1 step, wouldn't be able to go up 4 steps or 12 steps. And so there is a skip pattern again here. So if the one step or curb is coded 7, 9, 10, or 88, any of the activity not attempted codes, then you would skip over the remaining steps items to go to pick up object. We've had a fair number of questions come in about perhaps somebody not being able to go up and down a curb, but the person was assessed going up and down 4 steps. So if you want to be able to code going up and down 4 steps, just code going up and down 1 step, and then you'll be, if the person's able to go up and down 4 steps, they would be able to go up and down 1 step. They can use a railing or not. With the stairs, it doesn't matter. They can use the device, it doesn't matter. Just in the coding post-it note there, if the admission performance for the activity was coded using one of the activity not attempted codes, that is 07, 9, 10, or 88, a discharge goal may be submitted using the 6-point scale if the patient is expected to be able to perform the activity at discharge. So similar to what I talked about with walking, if the person I don't know, on admission was coded in 88, but you're expecting that the person will be able to go up one step by discharge, they can get coded, you know, a 5 or a 6 or a 4, whatever is what you think. Okay, so we do have a practice scenario here. So Miss A has ataxia due to a neurologic condition. She uses a quad cane while walking. When stepping down an outdoor curb, Miss A steps down as a physical therapist provides significant trunk support to help Miss A maintain her balance. When stepping up the curb, Miss A requires a significant amount of trunk support from the therapist. Miss A contributes effort. The helper provides more than half of the effort. So you can go ahead and enter what you think is the correct response on Slido. The options on Slido are 04, supervision or touching assistance, 3, partial or moderate assistance, 2, substantial maximal assistance, or 01, dependent. Okay, I'll just give everybody a few more seconds, especially for those online. Okay, it looks like most people are coding level 2. Okay, let's see what the answer is. So most of you are indeed correct, level 2. And the rationale here is Miss A requires a helper to provide significant trunk support while Miss A steps down a curb. The same amount of assistance is required when Miss A steps up the curb, resulting in the helper providing more than half of the effort. Going up and down the curb step does not have to occur back to back, but both are considered when coding this activity. So the next item is the next one related to stairs. So this refers to the ability to go up and down 4 steps. It can be with or without railing, with or without an assistive device. There is also a skip pattern here, and the rationale being that, again, if somebody is not able to go up and down 4 steps, they are probably not able to go up and down the 12 steps, so it's just skipping over one item. But again, the same approach. You can certainly code a goal, even if the person is coded one of the activity not attempted codes on the admission assessment. So next, we do have another scenario here for you. So with 4 steps, Mr. F is our patient. He is recovering from multiple lower extremity fractures and wears a walking boot and uses a quad cane. Mr. F slowly ascends the stairs, grasping the stair railing with one hand and the quad cane with his other hand. The therapist provides intermittent steadying assistance as he climbs up the 4 steps. Then he turns around and requires steadying assistance throughout the activity as he goes down 4 steps. How would you code Mr. F? So on Slido, the options are level 5, set up cleanup assistance, 4, supervision or touching assistance, 3, partial moderate assistance, 2, substantial maximal assistance. Give everybody a little bit of time. Okay, looks like most people have put in their responses, and most responses look like code 4. So let's see what the correct response is. You are indeed correct, level 4. So rationale here, Mr. F requires steadying assistance intermittently to go up the stairs, up the steps, and throughout the activity when he's going down the steps. If steadying assistance is either intermittent or throughout the activity, it doesn't matter. Both would be coded the same level, which is level 4 supervision. So basically, whether somebody's there for part of the time or during the entire time, it's still a level 4. Mr. F does not require weight bearing or lifting assistance, and that's why it's not a lower level. Next, our last step item is 12 steps. This refers to the ability to go up and down 12 steps with or without a rail. We do get a fair number of questions about this on help desk, the most common being, what if we don't have 12 steps to have the patient go up and down? Are we able to basically simulate it by going up and down 4 steps 3 times? And the answer is yes. If your clinical judgment is that you believe that that is an acceptable alternative and meets the intent, and the person basically, if they had to go home and they had 12 steps, they'd be able to do it based on your evaluation, absolutely. So I think most people would say that's acceptable simulation. Okay, so we do have a scenario here. Ms. B is receiving rehabilitation following a hip fracture. Her home has 12 steps from the entry level to the 2nd floor. During the discharge assessment, Ms. B uses a cane and the stair railing to ascend 12 steps, one at a time. The physical therapist provides contact guard assistance following behind Ms. B. When Ms. B descends the stairs, the therapist provides contact guard assistance and holds Ms. B's gait belt to steady her. So in this case, there is a difference in terms of contact guard being provided as the person, let's see, Ms. B is going up the steps, contact guard on the way down. So on Slido, you can put in your responses. The options are code 5, setup or cleanup assistance, 4, supervision or touching assistance, 3, partial moderate assistance, and 2, substantial maximal assistance. Okay, I'll just give you a few seconds, put in the response. Okay, it looks like most people have coded 4, and most people have their responses in. So let's see what the correct response is. And you are indeed correct, level 4. The rationale in this case, Ms. B requires contact guard, which is considered touching assistance. Ms. B does not require weight bearing or lifting assistance. So we actually had this question during the SNF training. If somebody has a gait belt, does that automatically mean that there's lifting assistance being provided? And the answer is no. In fact, this is a scenario where the code was 4. The gait belt was used just for precautionary purposes, but it was, I think, a discharge assessment, and the person basically only required supervision or contact guard assistance, sorry. Okay, the next activity is pick up object. So this refers to the ability to bend, stoop from a standing position to pick up a small object, such as a spoon, from the floor. So one important thing here is, again, this starts in a standing position. So if somebody is not able to stand, this activity would be coded one of the activity not attempted codes, possibly 88 or possibly 09, if the person was not able to be in a standing position prior to their current illness or injury. So here in practice scenario code number 23, Mr. M has Parkinson's disease and is deconditioned following a recent acute illness and acute care stay. Mr. M's tremors cause him to drop objects on the floor frequently. He is highly motivated to perform the activity of picking up a spoon from the floor safely. The spoon is on the floor next to the chair. Mr. M bends to pick up the spoon from the floor, and the therapist provides steadying support to prevent him from falling as he completes the activity. How would you code Mr. M? So the options on Slido that you should have are 03, partial moderate assistance, 04, supervision touching assistance, 09, not applicable, or 88, not attempted due to medical condition or safety concern. Okay, I'll just give you a few seconds. Okay, just a few more coming in now. Okay, looks like it's slowing down now. Okay, so most people coded 4, and I do agree, supervision or touching assistance. So the helper provides steadying assistance as Mr. M completes the activity as pickup object. The activity is to be completed from a standing position. So again, that's kind of one of the key issues to code this activity correctly. So we're going to move now to the wheelchair items. So there's several wheelchair activity items, but not everybody may be using a wheelchair, and so we actually do start off with a gateway question, and if the person does not use a wheelchair based on this question, then you would skip out of the wheelchair items, and again, that is an effort to reduce a bit of burden. So again, this first question, does the patient use a wheelchair and or scooter? If the answer is no, then you skip to actually the next section because this is the last series of activities. If the answer is yes, then you would code, you would continue to the wheel 50 feet with 2 turns. We do get a fair number of questions about this particular item. We did provide some guidance, coding tips in the manual, and I'll elaborate a little bit on that today. So you would use clinical judgment to determine whether a patient's use of the wheelchair is for self-mobilization as a result of the patient's medical condition or safety concern, or if it's really just used for transport purposes for staff convenience. So if the patient, let's say, actually this next bullet. So if the patient walks and is not learning how to mobilize in a wheelchair, and only basically maybe your therapy gym is on a different floor, and so there's just a transport person maybe who helps the person get, from whatever, the dining room or their room to therapy, but the person is not expected to use a wheelchair after discharge, they're not learning how to use a wheelchair, they're not doing wheelchair skills training, anything like that. You would use your judgment basically to determine if that person is really using a wheelchair. If they're not expected to use a wheelchair after discharge, you're not working on it during therapy, you would code no for this this item, this gateway question. If you code yes, you're going to be completing the rest of the activities because these, are required items. But if in your judgment the person's walking and really the wheelchair is just a transport issue, you can say no, and then you don't need to fill out the wheelchair activities. I know that's going to take clinical judgment, but I hope that at least helped a little bit. But definitely if somebody's learning wheelchair skills in therapy, they are using a wheelchair for sure. I know it gets a little bit tricky when somebody may be on, we've had some question with somebody on bed rest, and so, at what point do you say the person is using a wheelchair? You'll use your clinical judgment. So wheel 50 feet with 2 turns is the first wheelchair activity. So again, this is kind of parallel to the walking item. So this begins once the person is seated in the wheelchair, and it refers to the ability to wheel at least 50 feet and make 2 turns. Again, turns, 90 degrees, they can be in the same direction, 2 left turns, 2 right turns. You may be assessing a patient and you think it's important to assess them going both directions, so you may be having somebody, let's say, with a stroke, and you have them turn once to the left and once to the right. That's certainly acceptable. 90-degree turns occur at the person's ability level. So we do have another practice scenario here. So Ms. T uses an electric scooter to self-mobilize. In Ms. T's medical record, multiple clinicians note her need for supervision and verbal instructions for redirection when using her scooter. The physical therapist observes that Ms. T's scooter becomes wedged in a corner as she self-mobilizes approximately 6 feet with 2 turns, the distance from her room to the dining room, and requires instructions. How would you code Ms. T? So basically, it looks like there's supervision, verbal instructions in the clinical record, and then also the therapist observes that the Ms. T requires instructions. So you can go ahead and answer on Slido. The options in Slido are 06, independent, 05, setup, cleanup assistance, 04, supervision, touching assistance, 03, partial moderate assistance. I will give you a few seconds to code that. Okay, it looks like most people, I think, are coding. Okay, so most people coded 04, so let's see what the correct response is. You are indeed correct again. So in this case, instruction supervision are coded at level 4. Do want to mention that in addition to this gateway question for the wheelchair items, there's actually follow-up questions also. So the follow-up questions for both this item that we just covered, 50 feet with 2 turns, is present, and the same question is actually asked after the next activity, which is wheeling 150 feet. So I'll cover these together, but basically we are asking that you indicate the type of wheelchair that the person used, and the options are that it's either a manual wheelchair or scooter or a motorized wheelchair or scooter. And it's possible that somebody going kind of a shorter distance might be using a manual wheelchair, might be using a motorized wheelchair or a scooter for longer distances, so that's why there's follow-up questions for both distances. So the last activity is 150 feet, and this, again, is wheeling and starts once the person is seated in the wheelchair or scooter, and that's because we've already covered the transfer in a separate activity. We covered that some time ago. And we're now looking at the ability to wheel at least 150 feet in a corridor or similar space. So we have a scenario here for Mr. W. So Mr. W is recovering from a stroke and has right-sided weakness that affects his balance and a chronic respiratory condition that affects his walking endurance. By discharge, Mr. W slowly wheels a manual wheelchair 160 feet down the hall without any assistance from a helper. So if you could pull out Slido, you can go ahead and code this scenario number 25. The options are 04, supervision or touching assistance, 7, patient refused, 88, not attempted due to medical condition or safety concerns, 06, independent. Okay, I will give you a few more seconds. It's very slow. Sorry. Okay, I will give you a few more seconds. Okay, it looks like most people have, it's slowed down now. So most people coded 06. Not everybody. Most people coded 06. Okay, we've got some people changing their minds. Thank you. So let's see what the correct response is. Level 6, you are indeed correct. So Mr. W completes his activity during the assessment without any assistance. So that's actually our last activity, and we have a patient who has done very well. So I did want to just, again, talk a little bit about goals. I know Manisha covered this a little bit before, but basically For the mobility activities, there is an opportunity to put in a goal for each of the activities as part of the function process measure, which I will be covering very, very shortly. You're required to code at least one goal, and so there's many to choose from. So again, you can code either 1 through 6, or you can actually code one of the activity not attempted codes. So you could also, choose to code wheelchair or any of the bed mobility activities, or all of the above. Okay, so before I get to the summary, I did look at a few of the questions that had come in and got a chance to check with my colleagues to be sure that we had approved responses. So I will go over a couple of the questions that have come in, and I know there's an opportunity for more questions and answers later on. So this is just a few of the ones that have come in. So the first one is if a program interruption occurs during the admission assessment period, can you use assessment data collected during the day of the transfer out of the facility? And the answer is yes for section GG. If, for example, somebody is admitted, let's say today, and you're doing part of your clinical assessment tomorrow, and the person transfers out tomorrow to acute care for a program interruption, admission, assessment or evaluation data that was collected tomorrow during an initial evaluation before the transfer can be used. So I hope that's helpful. Another question that came in, let's see, if the patient is unable or declines to perform an activity due to fatigue or pain, do we code 07, patient refused, or 88, not attempted due to medical condition or safety concern? Probably you'd be coding 88. If somebody has pain or is fatigued, that's certainly a legitimate reason to decline doing something. So I don't, when we've looked at the data, I don't think we see a whole lot of 7 patient refusal. But if there's, in your clinical judgment, there's a legitimate reason the person's declining to do it, and pain certainly, or fatigue, after a stroke or brain injury, absolutely acceptable. Okay, another question that came in, what if the person does not have clothes on day 1? And I guess this is about coding dressing. So you do have a 3-day assessment period. So if somebody does not have clothes on the first day, but you're able to access clothes on second or third day from family, certainly assessment, an initial evaluation with those clothing items on day 2 or 3 is acceptable. You can certainly, if there's scrubs around, even like paper scrubs, anything like that, you can use those. If somebody has pajama top, pajama bottoms, that's fine. Our guidance is, the CMS guidance is that a gown is not enough to basically do an adequate assessment. But pajama bottoms, pajama tops, extra clothes that might be available. I know some IRFs have kind of clothes that are available, sweatpants, whatever, that can be used. If you really don't have any clothing to assess the patient, you might code 10, but hopefully that's very, very rare. Okay, so I think that is at least some of the questions. We will definitely get to others later today, and as I said, we really do appreciate hearing all the questions. It really helps us to solidify guidance, and also it helps us come up with new scenarios. We do try and give different scenarios in training over time. And if you want to look at even other scenarios, sometimes you can look at prior training sessions that have been done where you'll see other examples. So in summary for this section, between Manisha and I, we covered all of the GG items, and we talked about how there is basically the underlying idea that we're assessing need for assistance for self-care and mobility activities. We went over the item definitions, because obviously the item definitions are very critical. For example, like that pickup object where you want somebody in a standing position. The coding instructions we reviewed with you. We did some coding tips and reminders, and again, many of those were inspired by you, so thank you. And also we went through some practice scenarios. So I think you've previously been asked to record action plan ideas. Certainly feel free to do that if you'd like to now or at a break. And if you have any questions, please submit them on Slido. As I said, we will be addressing more of the questions that come up.